Thank you so much, Shah. Thank you, Bisma and Iftihar. I'm really glad to be a part of this platform, and I'm really honored to be a part of session with an amazing guest speaker who is a mentor and inspiration to many, and definitely one of my favorite speakers as well. So I think we should start, sir. Should we proceed?
Sure.
Okay. Okay. So, there were basically many questions. Shwab, Bisma, and Iftihar basically distributed a form where many doctors from all over the world gave us questions and various scenarios to ask from you. And some of them also might be asking those scenarios live. But since people are reluctant to share their mental health problems usually in front of everyone, so we decided to keep that anonymous, and we have formulated the points, and we'll be going through those. First of all, since you have worked in Pakistan as well, and you still work here, and then you are working in Canada, so what is your experience regarding the mental health of doctors, especially the young doctors? How do you see and rate the mental health of young doctors in Pakistan and in Canada, or maybe generalize it to the Western world? And what are the differences that you see? What's your general take on all of this? So,
Okay. Bismillah Rahman Rahim. Thank you very much, Shua, and all the team members to invite me. It was supposed to be last Saturday, but unfortunately I was on call, so I could not do that. So today was a better day. Uh, when I was in Pakistan, well, by the way, I love Faiz Ahmed Faiz, not because he is a poet who writes a good poetry, but because it's more like humanistic approach. The actual emotional component of probably being a doctor, I feel that it's more closer to me. So वो फैज की एक नज़म है, मेरे दिल मेरे मुसाफिर हुआ फिर से हुक्म सादिर कि वतन बदर हूं हम तुम दें गली गली सदाएं करें रुख नगर का कि सुराग कोई पाएं किसी यार नामाबर का सरे कुए नाशनाइयां हमें दिन से रात करना कभी इससे बात करना कभी उससे बात करना हमें ये भी था गनीमत जो कोई शुमार होता हमें क्या बुरा था मरना अगर एक बार होता. Unfortunately, in the life of a doctor, it's unfortunate that we have to take multiple steps, and every step leads you to a different kind of a professional life, and those steps are actually very crucial. When we say a good doctor, there are various literatures available. People say there are 10 qualities a good doctor should have. People say that there are 7 qualities a good doctor should have. Whatever the number they describe. But the good doctor means that he should be, number one, conscientious. He should be empathetic. He should be passionate. He should be having a vision to move forward. He should have a good decision making powers because you never know what is in front of you, and then you have to take the decisions right at that time. And maybe sometimes these decisions are not actually what the books say or the literature say. So your decision making capabilities should be there. And a good doctor should have a good vision for the future as well. Now, this is very, very traumatic that when people are going for graduation, medical degree, most of the doctors who are becoming the doctors, they are becoming doctors because my mom said that you should be a doctor, or my dad said that you should be a doctor. And we become doctors. And then when we are doctors, then we start thinking about it. What are we doing in this profession? It's a strange profession. It's a boring profession. It's not something that I should be looking forward. If you really have any of those thoughts that you are misfit into this profession, then of course you should review your decision. Then the second step, once you are a doctor, medical doctor, The second step, the most important component, is choosing a specialty. Again, it's very traumatic that nobody guides you how to choose a specialty. And usually we choose the specialty because I went to UK and I was not able to find a seat there in the specialty I wanted, so I chose anesthesia, or I chose psychiatry, or I chose pathology, or whatever. So that drag into something is always complicated. And this happens everywhere across the globe. So doing a medical graduation when you are not passionate about it, and then going for a specialty where you end up because you feel that there was nothing, nowhere else to go. I always say it to most of the doctors that you people should, one, first review your decision whether you want to be a doctor or not. Because being a doctor, it's very challenging throughout your lifespan. And over the period of years, there are so many research studies conducted that doctors have more burnout phenomena, stress-related issues, family issues, personal issues, because they are always into a situation where they have to make the decisions and move forward. And then attitude of the people. So people give comments, they are not happy, they are demanding, and you are not able to fulfill those demands, and you feel, oh, this patient of mine was asking this, how that is possible. So in that kind of a situation, again, it's more frustrating for most of the people around, which unfortunately again creates problem. One, review your decision if you really want to be a doctor. You can tolerate the criticism of the people, especially the patients, the seniors. You can fight with bureaucracy. You can fight with the administration. You can have good collegial relationship with your clinical team, and then you are able to perform your responsibilities appropriately. If those things are lacking, this means there is a trouble. Choosing a specialty should not be at all according to your financial incentives, because you were unfortunately not able to find a place, and so on and so forth. Choose a specialty according to your personality, what kind of a person you are. If your personality is a sensitive, anxious kind of a person, then try to choose specialty where you should not have encounters with the patients. If your personality is outgoing, bold, interactive, choose a specialty where patients' interactions are more required. If you feel that you are overactive, energetic, enthusiastic, emergency is the best job. If you think that you have skills in your hands and your hands can move very fine and in a refined way, choose surgery. If you feel that you don't have a family commitment and you can spare 24/7 time, any time of the day or night, choose gynecology. If you feel that you prefer to stay in an office and do your job peacefully, choose radiology. So it's all dependent on your personality. When I chose I give you my example. So when I chose my specialty, I was passionate about surgery. I wanted to be a surgeon, and I thought that I'll be a good surgeon. I can do surgeries and I have the skills to do it. But then I realized that there are two major problems with the surgery. For me, myself, I'm not telling that there is a problem with surgery. No. For me, the surgery, one, I was a little bit more incoordinated with my hands. So, and that was unfortunately the tricky situation. And second, I thought that I want to go up to some place, achieve something in life in future. So I always wanted to teach people, and I wanted to be a teacher. because I thought that I was having a good teaching skills. I don't know whether I have it then or not, but I always wanted to do that. So that was a passion inside. And in surgery, I thought that it's so much competitive that I won't be able to be an assistant professor or a professor in a short period of time. And by the time I will be a professor in surgery, probably it will be near my retirement around the age of 60. So I thought about it, I discussed it with my colleagues, I just explored my skills myself, and then I realized that, okay, I'll go to psychiatry. At that time, when I became a psychiatrist, the medical school from where I graduated, Allama Iqbal Medical College, the psychiatry was not at all a favorite subject of the student. So I was always again tell it to the people that one day I was forced to attend a psychiatry lecture. I went into the psychiatry lecture because I was supposed to mark attendance of 126 people in that lecture. And I went there and I was sitting in the big, huge auditorium with one professor delivering a lecture in psychiatry. And there were three of us in the whole of the auditorium. Me, myself, one who was sitting next to me, and one at the last seat. And he started marking the attendance, and he marked approximately again hundreds or so. And then it came to me, and I started marking. And by the time I finished marking the attendance, I looked at my side, and that man was gone. So it was just me, professor, and the one guy at the back. And after 10 minutes, that guy left as well. So I was all by myself in front of the professor, and he was teaching psychiatry. So it was not at all a favorite subject. Why was it? Because again, I felt that probably the passion in choosing speciality was missing. And when you don't choose the speciality according to your passion and personality, you are bound to be just a routine, ordinary doctor. You cannot make a difference. You can make a difference only if you choose the speciality according to your passion. Even if you want to lose some years of your life, maybe 2, 3, 4 years, that's worth it. Because once you choose the specialty, you are stuck with the specialty for the rest of your life, maybe 40 years from now. So 30 years, 40 years, 50 years. What will you do? You won't make a difference. It will not have an impact on society. So make sure that choose specialty careful. Same happens in Pakistan, same happens in Canada. People just choose. Here, the family medicine takes about 2 years to specialize, and any other specialty takes about 5 years. So this means that people choose family medicine a lot because it's just 2 years after graduation medical degree, and they go to the family medicine. But the family medicine burnout is highest ranking in literature. And why? Because people choose speciality not by choice, but by convenience, which should not be there, which should not at all be there. So what I have seen the difference, the people who have passion for their speciality, they excel in their speciality and they become something in their lives. Not all people in gynecology becomes professor of gynecology. Not all people in surgery becomes professor of surgery. Not all people in pathology becomes professor of pathology. Only people who have passion for their specialty can do so. I don't know if I have responded to your question or not. It was a long answer, and I apologize for that. Cut me off if I'm talking too much.
It was a very interesting explanation. Whatever you said, we loved it. And yes, you are an amazing teacher.
Absolutely.
So, any other question?
Okay, so the first question that I'd like to put forward is one which is asked by many in medical profession. I mean, how to deal with the toll that the examination system have on our mental health. I mean, a medical student or a doctor during exam season is really a sight to behold. No one can relate to it. And God forbid, what if someone fails an exam? I mean, we have seen people committing suicide because of the effect that it has on their mental health. So, how do you, uh, what would you say to us to how to deal with it?
Okay. So, yes, examinations are always stressful in any part of the world. And whenever you want to give an exam, of course, you feel stressed out. We always say that the more the stress, the better you perform. But there is a point when the stress is too much and your performance starts going down. That is a crucial point where unfortunately you need help. In most of the exam situations, if again, what as a psychiatrist, I can tell you that if you are appearing in the examinations are always technical things. They're not actually again something that you can just pass by reading too much. Any exam you take up, any exam, it's always technical. If you know the technique, you'll be able to prepare for it, be less stressful, and pass the exam. If you don't know the technique, then unfortunately you'll keep on studying and you will fail, despite studying for months and months and months. So any exam, like MRCP has its own format. And there are schools who train you to prepare for the MRCP exams. And those schools actually teach you the basic skills or the techniques used in that exam. USMLE has its own technique, how to appear in the exam. So the first and foremost thing to appear in any examination is that you should try to study the techniques used in that examination. If you are able to learn the techniques, which may take you maybe 2-3 weeks before you will be able to understand the whole of the situation. So this is the exam. It is based on MCQs. It is based on one best answer. The one best answers and the questions are probably more clinical based, scenario based. The answers are maybe relevant or sometimes more theoretical. What kind of the situations are asked in the exams? How do you have to perform it? How much time is required to do it? How much time each question will be needing from me to think and recall and reproduce? All of those things, you should be able to learn them before start preparing. Then in any exam, there is a set of pattern, which we call table of specifications. So the table of specification for MRCP, USMLE, clinical assessments and exams, it's always there. Now, if you know the table of specification of a certain exams, it's easy for you. If you don't know the table of specification, you'll keep on focusing on the subjects and the content in the textbook of the things which probably are not important from the examination point of view. So that is important too. Now, the next part of your question, that people commit suicide because they are stressed with the exam. I don't believe that is the situation. People commit suicide because they are prone for this psychiatry, morbidity, or crisis situation. It's not, it's just a warning sign. And the warning signs appear much earlier than failing in the exam. So if a person starts feeling bad, low, self-esteem compromised, having multiple physical issues, not able to cope with the things, feeling as if I'm not interested in having friendship, relationships, talking to people, remaining isolated, focusing more on your own self, very sensitive, anxious, number of other things, you are bound for a drastic bad consequences. It's not the failure in the exam that will make you commit suicide. It's actually much more beyond that, and it starts much earlier than people expect it to be. So failure in exams, well, what will happen if somebody fails in the exams? Nothing. You will just lose 3 months of life. What else? As I mentioned you earlier, choosing a specialty, even if you have to waste 3-4 years of your life, it's worth it because that specialty will be with you for rest of your life. So you want to save the 30 years of your life and be happy, or you want to just pass the exam and do something which probably where you won't be happy. That's a tricky situation. So choose specialty carefully. If you have warning signs where you feel that you are getting stressed up because of your exams, definitely consider talking to someone and talk to someone professional. And there are multiple signs, as I've told you, feeling isolated, feeling lonely, feeling very sensitive, feeling as if people are not bothered about you, feeling having relationship issues, not able to talk to your family, not able to talk to your mother, father, brother. You feel that everybody is mean, miser, kamina. But all those things are actually not the way we feel. It's very easy to blame the situation. It's very easy to blame others for the situation. It's very easy to blame the system for a situation. Actually, it's not like that. If you are okay, everything will be okay. If you're not okay, everything is traumatic and bad.
Thank you very much, sir.
Okay.
You have surely cleared a lot of the stuff. The second question which I'd like to ask is, I think we can all agree that generally there is a stigma regarding the mental health. But one thing which is not talked about nearly enough is the stigma that mental health professionals face just because they work in this profession. I mean, we have all grown up hearing the phrase that mental health professionals are half mental themselves. So, what is your take on this thing that our mental health professionals given the due respect that they deserve, and what is the effect of this stigma on the health of mental health professionals?
ओके अगेन वो फैज का एक कथा है, दोनों जहां तेरी मोहब्बत में हार के, वो जा रहा है कोई शबे गम गुजार के, दुनिया ने तेरी याद से बेगाना कर दिया, तुझसे भी दिल फरेब हैं गमे रोजगार के. Our rozgar is unfortunately tricky. And mental health, yes. So I've been fighting throughout my life with the bureaucracy, with the administration, with the colleagues or services mein. When I was working in services hospital. So I worked in services hospital for more than 20 years. I don't want to mention that, but specifically, but it still came up. And I was promoted from senior registrar to assistant professor to associate professor and professor. And then I left the job much before my retirement. And then I came to Canada. And I was always fighting for this specific thing, education related to mental health issues. So first time I went to Professor Faisal Masood, late Professor Faisal Masood, my teacher, my mentor, my senior. He was a gem of a man. He was very kind to me. I owe him a lot for my life and my career, besides some of the other people who played a very vital role. And it was a very strange kind of a relationship with Faisal Saab. So when I went to him and asked him, I want behavioral sciences to be taught in first year med school. And he said, what are you going to teach in behavioral sciences? I said, I want to teach about attitude, the behaviors, the psychology, the stress, the burnout phenomena, blah, blah. And he said, you cannot change them. They will be like that. There is no fun in teaching attitude and ethics to the children. Ethics, they learn from their families. And he was partly right. Yes, we do learn ethics from our families. But still, I said, well, maybe if I'll be able to teach and I can make a difference in the life of at least 2 people out of 100, it's worth it. I want to go for it. And he said, I don't have that kind of a setup where I can spare 50 hours for behavioral sciences. We kept on having arguments, discussions, and all that stuff. And ultimately, we were successful in bringing in the behavioral sciences and services hospital. And we started teaching. And I don't know how much difference I made in the lives of the people, but I know this much, that I tried to change the attitude of the people towards psychiatrists. I tried to change people concepts about mental health. I tried to change the attitude of the people towards mentally ill people. My target always was the same. I want to educate them, to make them aware that like any other organ, stomach, heart, kidneys, lungs, our brain is an organ, and our brain structural abnormalities are dealt by the neurologist, but our emotional, memory, and other functional areas of thinking are actually psychiatrist's domain. And like any other person, any individual, any organ, the brain, thoughts, memory, emotions are important component of health. This is what we should acknowledge and realize. And I always give an example. A single light stimulus in a pitch dark room can stimulate 1 million neurons in your brain. And these neurons are cells. And these cells are connected not through a physical contact, but through a synapse, which is a gap. And that gap is filled up with the neurotransmitters. And these neurotransmitters actually convey the electrochemical gradient from one neuron to another. And if one neuron gets affected, this 1 million connections, they get upset, and you will act oddly. So your one stimulus around you can lead to one abnormality in a neuron, which can lead to one behavioral abnormality in your life, which means the whole of the day can be ruined because of one stimulus in a day. Who is going to correct that? We, the psychiatrist. So if you acknowledge that this vital organ, the brain, has something in it which needs to be corrected, because no human being is a perfect. I'm not a perfect human being. I have a pot belly. I have, again, gray hair. I have a big nose, or I cannot see properly because I have to wear glasses. Why I'm wearing glasses? Because I want to correct my vision. Why I want to take antihypertensive? Because I want to correct the elasticity of my blood vessels. So why can't I correct something happening inside my brain, inside my mind? And if I have to take a pill for it, why not? The problem is lack of education of the doctors, because people feel that, oh, you go to psychiatrist, you will be given antidepressants, they are addictive, and you'll be in a chaos. And I will always tell, well, psychiatrists prescribe no dependent producing drug, and they prescribe much less what other people are prescribing. So in any cardiologist prescription, you will see an antidepressant and a benzodiazepine. In any gastroenterology prescription, you will see an antidepressant and a benzodiazepine. We don't do that. We don't do that. We treat people according to their behavioral and emotional problems, not just giving an antidepressant, not telling it to the person, what is it for? So most of the people don't know that they are taking antidepressants and a benzodiazepine, and they are taking it. And I in everyday clinical practice, I have to tell them, I went to a gastroenterologist and he said, KG, your meda is having a sozish, so your mind is not working properly. So you take the medicine for meda and your mind will be okay. How that is possible? These two organs have no connections with each other, except the brain controls the stomach, not the stomach controls the brain. If you realize that and understand that, you'll be able to find out. So the
But
stigma.
stomach controls the brain, you know.
In Pakistan, everything is controlled with the stomach, right? Nihari खा लो, दिमाग ठीक हो जाएगा, पर खच्चे उड़ जाएंगे. Okay, so this is how the things are, unfortunately, and the best way to correct it is to educate. If I'm sitting in this platform, in this forum, my target was to make sure that people should understand that your anxiety, your depression, your burnout, your stress, your interpersonal relationships are all related to your mind. And if you need a help, don't hesitate to go for it. But of course, you take help from an appropriate person, not a quack who will probably give you 7 medications and nothing will be working for you. So you have to make sure that if you need help, any issue related to your well being, mental health well being, emotional problems, thinking problems, you're not able to remember things, you forget things, your attention span is short, you're not able to focus, you are not able to concentrate, you're not able to think properly, you fight from morning till evening because one of the colleagues said something and I was not able to take care of my patients who are my prime responsibility. Then there is a problem inside you. And we always believe this is what it is. वो हमारे दीन में भी है ना कि और हमारी स्पिरिचुअलिटी तो सारी इस पे बेस करती है. You correct yourself, you will see the world from a different viewpoint. मैं की नफी कर देने में सब कुछ है और मैं को ठीक कर लेने में ही सब कुछ है. This is what the life is. So that me is actually the source of problem. And you have to correct me. You'll be okay. If you won't be able to correct me, you won't be able to take care of anything. Anything.
Okay. Okay, thank you, sir. Sir, before proceeding forwards, I like to ask if anyone from the audience wants to ask any question. Anyone?
People are hesitant because they are facing a psychiatrist. You don't have to be hesitant. Yes, go ahead, please.
Can I ask one?
Shwa wants to ask a question. Okay,
Yeah,
Shwa.
go ahead.
Okay, so it might be a little bit off topic, so I apologize in advance. But I was just wondering, how do you psychiatric trainees tackle their mental health? Is it, do you guys go through the same issues during your daily ward stuff or during your personal life, or is it different from?
Honestly, I was expecting this question. Honestly speaking, I was expecting this question, and this is one of my favorite questions as well. Yeah.
Are you asking this from me, Shwa?
From you guys, from the psychiatric team. So anyone can answer.
Okay. So that was a little unexpected question. Okay, but okay, let's see what Dr. Fahadis has to say about it first. Then okay, Dr. Fahadis, what's your take on it?
My take. I mean, yes, obviously we do face a lot of the same stuff that you guys are facing, but I think there is a general feeling among psychiatrists that you start looking for troublesome behavior in other people. I mean, even in surgery.
Oh, he disappeared.
Some connection issue, I think.
I think his signals dropped, so I'll take over it. Yeah, we often discuss it among the residents that we start seeing problems in other persons, so we have to switch our psychiatrist off when visiting other wards. So this happens. Asa, your question was about how we see our mental health. So yes, we have the same issues as faced by other people, but I think that. Uh, as a psychiatrist trainee, I have more insight to my problems. Any psychiatric resident will relate to it. we have more insight. We know that our emotions are validated. Whatever emotions we are going through, we know they are validated, and this creates little more uh, understanding among us for the others, and I think it makes us a little more compassionate, because it allows us to see things from a lot more perspectives than only a perspective from our side. And one thing what I think is that psychiatry does make you more vulnerable when, especially, you are not in a good mental state. But on the other hand, it also makes you a little more resilient. So the conclusion is that you have to find a balance between being resilient and being vulnerable, so you can channelize your emotions in a more convenient way that is more acceptable to yourself and the people around you. And one thing that I have learned in psychiatry during my training from my seniors, that never take decisions in extreme emotions. So, those decisions are not good. So, you always take a decision when you are in a neutral state of mind. And any decision made in extreme emotions will cause trouble. So, I think I have answered your question. That was an answer.
That is the essence of the story. The last two sentences Mahanur said, वो अगेन फ्रेस का एक कथा है ना, रात यूं दिल में तेरी खोई हुई याद आई, जैसे वीराने में चुपके से बाहर आ जाए, जैसे सहराओं में हौले से चले बाद नसीम, जैसे बीमार को बेवजह करार आ जाए. सो साइकियाट्रिस्ट को बेवजह करार आ जाता है, और वो that करार is actually that thing which Manu was saying. So as a psychiatrist, I always say few things. One, never ever try to memorize your patients. We are seeing emotional trauma and hearing about emotional trauma every day. So if Mahanur talks to me something about her emotional problem, and I'm trying to convince her that this, what it should be, afterwards, I should keep my mind or make my mind blank through it. So I register, never register the problems faced by other people, despite the fact that I'm giving them some suggestions, right? So never ever register and put the things in your long-term memory related to your patients, related to your colleagues. Never. Once you are out of your work, forget about everything. Forget about everything at workplace. How are your colleagues? How are the patients? The more you will try to recall what happened this morning during the work, the more it will take place in your long-term memory, and the more traumatic it will be for you after some time. So one advice, never ever to repeat the things at the workplace. Don't make them part of your long-term memory. One. Second, as she was saying, never ever take any major decision when you are emotional. Take the decisions at a cognitive level when you are peaceful, calm, and comfortable. That is important. And third, if you feel that you need help, you should talk. That is the best way to do. I see 3-4 hands raised. Nazir, Bisma Nazir, and Ali Iftikhar. They want to ask questions. So go ahead. Who wants to go first? Bisma?
So thank you for all the informative session that's been going on so far. Just a quick question regarding what I was thinking from your experience and what you've seen, especially among the medical students, doctors, and all our colleagues in the medical department. Have you ever noticed, or that might just be my feeling, do you think that the reluctance or the denial to accept all the mental health issues among medical colleagues is slightly bit more, which I think is probably a bit more than in among us as colleagues and being medics than our general society and people around us, because being doctors we might, which I have a feeling. So I just want your take on it, how we take on it. Because sometimes if I'm depressed, maybe I'm going through some hard time, and as a profession, medicine is a profession which is slightly more demanding.
and asks you for more, and managing your family life, social life with your career is not easy. So we all agree on it. But and then accepting the fact that this can affect our mental health, and we can go through phases where we might be depressed, our mental health might not be the best. The reluctance or the denial among medical colleagues is slightly bit more, and we don't get to the point where we accept or seek help on time than anyone else could be, because we just put it on maybe being fatigued or tired and just take it as a part of life. So it was just, if we can just guide on if there's no reluctance or denial in particular among the medical or the medics.
There is no doubt about it that as doctors, again, we don't think about our mental health. And yes, you are right. Social situations, difficult situations, like if you are, again, women, the female doctors, you have to take care of your job responsibility, you have to do a post graduation, you have to see your patients and then getting
I'm
back
sorry to
home.
interrupt you. I'm really sorry to interrupt you, but my next question was a little related. So I'll ask that question also, and then you can answer at the same time, right? Can
Go
I?
ahead. Go ahead.
Sir, so this is a question that has been put forward by my many female colleagues who are working in other fields and even in psychiatry, that there's a general notion, especially in our society in Pakistan, India, that working women can't be good mothers. You know, they can't manage a household perfectly. There's a lot of pressure from the society, and that affects the mental health of many young ladies who want to pursue their careers and excel in their fields. Also, the working ladies who are especially new mothers, they have a specific thing called the mom guilt. They are very much guilty about leaving their little children behind at homes, or even in daycare services. And then there are some ladies who have taken break between MBBS and residency to focus on their personal lives first. And when they think of joining back because they see their other friends and colleagues working and doing residencies, they face a lot of pressure, and there's a constant battle in their mind. So, how should we tackle that situation? What's your take on this? So, I thought the questions were related, so you can answer at the
So,
same time.
Bisma, yes, I absolutely understand that lots of toll has to be taken by the female doctors because, again, professional life, personal life, crossing the boundaries, and how to manage it. Three things are most important in your life: your comfort and your happiness, and your futuristic planning. Think about, we all as humans have these responsibilities. So we have professional life, personal life, family life, social life, friends, etc. How to keep up a balance between them. And I always say one thing: you cannot do everything in life. You cannot. I still think of doing so much, but I cannot because I'm not able to. I don't have time to. Simple definition of stress is when the resources are less than what is required. So pressure is more and resources are less. If you have to reach somewhere at 10, you leave at your house at 9:55, and you know the transit time should be around 15 minutes, you'll be 10 minutes late, you'll be stressed out. Simple, right? So when the resources are less than the pressure, you will be stressed out. Same happens with the family life. It's not a bad option at all for females to take a break, to have a family life. I think that's important parameter in your life, to have kids, to raise kids and restart your professional life again. And this is the most sensible thing to be done. So you do graduation, you get married, you raise two children. When they start going to school, you restart your work again, which is absolutely fine. Absolutely fine. There is nothing wrong with it. Now, then you say that it is too much burden. You have to work first, and then you have to go back home, cook the food, take care of the children, take care of the husband. The husband is not getting up. He is just taking a seat on a sofa and demands that the food should be served, the roti should be a hot one, just coming out of the tawa, and the salan should be very fine one and the fresh one, of course, you will be stressed out. There is no doubt about it. Then you have to choose what is your priority, your profession or your family life. And if your profession is your priority, then you have to sacrifice few things in your family. You have to make your husband understand that you cannot cook a fresh chapati for him every evening when you are back from work. And if he won't agree, of course, it's a stressful situation. You should be able to understand how to cope with it. That's a long thing, but I will briefly tell you. So your priorities matter the most. For every human, your priorities matter the most. Some people are lazy and they just want to make sure that they are comfortable and they don't have to do the work. Fine, it's their lifestyle, it's their life choice. But expecting that they won't do anything and they will be at the top of the world, that is unrealistic. Your priorities should match your futuristic passion and goals as well. If there is a disparity in the two, you want to be an excellent professor of gynecology, and then you feel that you have to first raise the kids, take care of the husband, take care of the family, and make sure that the sas is not talking too much about it, and then you feel that you will be able to compensate for the professional life as well. Of course, you are human. You cannot do that. First, you have to make sure that everybody as a stakeholder should be there. They should be able to understand, and then you should focus on your professional life. Otherwise, na yahan ke rahenge, na wahan ke rahenge. That place, family, they will always be taunting and criticizing. And at work, the professor, the administrator, the head of the department will keep on taunting. And the exam, you will be having problems again. So please, 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 in nutshell, first, prioritize your things. What comes first? Then you have to plan. We never plan for the future. You should have short-term goals, mid-term goals, long-term goals. In psychiatry, we always believe in that. Short-term goals, mid-term goals, long-term goals. Short-term goal, I have to make sure that my son starts going to kindergarten before I start my post-graduation. Mid-term goal, I have to complete my post-graduation and then I should have the second baby. Long-term goal, both my children will be fine. Once they will be in the school, I can spare some time at my education. I'll do my post-graduation and then I will start the job. You have to think about all these goals, short-term, mid-term, long-term. If you are not cognitively able to understand and process this, things won't go well. You will be stressed up. You will be in a chaotic situation and you will always feel bad about yourself and the people around you, and you will curse yourself. First, please, 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 all doctors, try to make or prioritize your things around you. What comes first? My son, my husband, my mother-in-law, my profession, my life, and my financial goals. And then try to follow them. Be very methodological. Ye zindagi, it is not something like this. It has to be planned. For every behavior that you are having, it will have a consequences in your life. And if you are able to control your behaviors, the consequences will be on your side. If you won't be able to control your behaviors, the consequences will be chaotic and you will be traumatic and one day a suicidal as well, unfortunately. Okay, if Ali, if the
So sorry to interrupt. I'd like to add something upon the goal thing. I mean, it's one thing formulating a goal that, you know what, I'll start having a baby once I get the residency. The problem arises when you fail to achieve that goal. I mean, what if you fail your first attempt at part one? Then the pressure builds up. Your mother-in-law wants you to have a baby and you are not getting into the residency and things starts boiling up. It's one thing to have a goal, but it's another thing if things don't go according to the plan.
If
What is your
if the
plan B?
goals are realistic, they are achievable. If the goals are unrealistic, अनोखा लाडला खिलन को मांगे चांद, तो फिर चांद नहीं मिलेगा. ठीक है, चांद तो किसी को नहीं मिल सकता. You failing an exam is a separate story. I don't believe in that. But again, as I told you in the beginning, if you really want to pass the exams, you have to be very calculative about everything. If you know the technique, if you know the table of specifications, if you know the time frame, if you know what are the MCQs type, if you know the situations, if you have talked to your seniors, if you are able to ascertain the precise thing for the exam, all of these things, and then prepare for it, you will never fail. But you will definitely fail if you will be casual, if you will be non-systematic, if you won't be not structured, if you are not aware, if you're not familiar, if you are having surprises. Oi, that question kitho aa gaye? To mainu pata hi nahi si. Now, these surprises always will definitely make you never ever you will pass the exam if these kind of surprises are there. Oh, ye bhi puchna tha inhone. So the question is, if you don't know ye bhi puchna tha, then you are not eligible to appear in the exam. And this is what I'm saying. I'm repeating it. It's hard to accept it, but it's a fact that you have to prepare yourself well for the things. And if you are prepared, you won't be stressed out. So this afternoon, I'm giving you again example of my life. So this last night, my wife said to me, we are supposed to go to Toronto to pick up the meat, halal meat, of course. I have to drive 2.5 hours to get the halal meat and 2.5 hours coming back. It's usually a journey of about 8 hours in total, and it's usually on Saturdays. And I told her, I have a commitment tomorrow at 1. And I won't be free till 1:30. So what should we do? And she said, Gosht bahut zaruri. So I started thinking about it. Gosht bahut zaruri hai, kya karna hai? Okay, gosht bhi aana hai, and I have to do this activity as well. If you plan, and if you are able to plan properly, this activity will be done. I'll be able to drive, I'll be able to get the meat, and I'll be able to come back. Okay. But if I won't plan, this will be chaotic. I'll be anxious in front of you. I'll be thinking about that. I won't be able to go and come back for 8 hours time. This is what I'm saying. Plan your life. You will not fail the exam if you have a good planning. You will not fail in your life if you have a good planning. You fail in life, family life, personal life, situational life, because you have no plans. You are going as the waves are taking you there, which is unfortunately a big reason for a failure. Planning cognitively, effectively, and then reproducing will give you the results. Emotional charged, very much emotional with the family, very much emotional at work, too much passion, too many things to do, you will be stressed up, you'll burn out, you will achieve nothing. Set small goals, achievable targets, move appropriately, and things will be okay. And then even kapatti saas bhi kabu aa jayegi if you will be able to handle carefully. ठीक है, वो सास आके ताना मारती आ गई, ठीक है, and then you are, oh my God, okay, she's talking again, what the bloody. So, and then you will react, and you will react badly, things will fire back. She won't let you live in that house. peacefully. Well, she will let you know, live in that house, but not peacefully. If you really want to be peaceful, you have to understand the personality, the comments, the criticisms, the shortcomings, and of course, the strengths as well. वो कहते हैं कि उस जगह पे मारो जहां पे साह भी ना निकले तो मार जाओ. That comes only with the technique, not with emotional content. You have to be careful. When saas bahu ke jhagde mein they come to me as a psychiatrist, I cannot say that I cannot change your saas. I won't make you go divorce your husband, of course. But I can make you strong enough not to react to her emotional talk and behave oddly and fail in your life. So my target is to make the bahu strong enough to face the consequences and get well. And same goes for the saas. I want to make the saas strong enough to tolerate the bahu and make things going in the life. That is what the psychiatry is. That is the essence of psychiatry. And this is what we practice every day, the same old story, right? The first thing I ask from my patient is the demographics. No, not the demographics in the way you people ask, naam, umar, sex. No, I ask demographics in another way. I ask them, what's your name? From where are you? Who lives in your house? What are the family dynamics? Who is doing what at your house? How much space do you have at house? Things like that. They are all demographics. But I get hordes and hordes of information related to the patient by just talking about them. And the patient is surprised. Well, doctor is not asking about my disease or my problems. He's asking about my house. What the bloody hell he wants to know. Why he wants to know ke ghar kitne rakbe pe hai. Is it a 10 malla house or a 5 malla house? Of course, it's very important for me because I want to assess the social status to prescribe the medication. Planning, planning, planning. Cognition, emotions, and thinking should be aligned appropriately to get the desired results. I'm a bit chaotic, right? Myself. When I'm talking, I'm too much emotional. When I'm teaching psychiatry, I'm always like this, which I apologize, but yes, this is what it is. When the planning fails, if you plan properly, plan will never fail. If you plan emotionally, plan will definitely fail. If you plan cognitively, plan will never fail. Mission impossible, always achievable because they know what to do, when to do, and how to do. There are drastic consequences. In the middle, by the end of the movie, things are successful. So planning matters.
Iftihar wants to ask something.
Yes, he's raising hands for quite some time now. Yes, Iftihar, please go ahead.
Hello, sir. Thank you so much for giving us the opportunity for this full session. Iftikhar Ali, I'm the other member from BTAC. Just listening to you is such an amazing with this Turkov fast poetry, and absolutely all the things that you were telling. I'm just recalling the story, the man who was a hospital, and I think that every symptoms I am at the moment feeling that, and I think I need a session. But my question at the moment is, I'm currently working in UK. I'm working in urology as an SHO. The problem I'm facing, and most of my colleagues is facing, in terms of choosing the goal, especially if you look at the peer pressure and the social circumstances and the other experiment and the other stories of your colleagues and your seniors who've come to UK and they couldn't pursue their goals or their desired specialty, and they ended up in family medicine to kind of be in a bit more like lenient specialty, and also people like me who doesn't have a proper goal or who doesn't have a passion for a proper specialty. So although you have kind of answered in your in the previous question, but as a mentor or as a teacher or as a professional, what's your take in terms of choosing the goal, or especially for a person who is not very keen about any particular specialty, how he should choose for his desired specialty?
Okay, good. Iftikhar, at least you verbalized your dilemma, which is, again, a strong point, I believe. This means that you are a strong man. I don't know you much, but of course, your expression conveyed to me that you want to resolve the issues, but you're not able to because you don't know how to. And the ideal way to do that is to, again, one, I personally suggest to you that you should have one-on-one interaction with somebody who would be able to take your interest, take your family dynamics, your financial situation, your time frame, your age, and other parameters into consideration and guide you. Because you see, as you mentioned that you are an SHO and you are trying to take the family medicine, well, it's not at all a bad specialty. It all depends if you have a passion for it. So maybe you are in a right specialty. By virtue of it, you have to find interest in that specialty. And how to develop that, you have to find that. That's important. Either this specialty, if you are really made for this, fine. We have to find out the good points and the bad points in it, and then make you understand that this is best for you, or change specialty. But that all, Iftikhar, honestly speaking, I cannot comment to anyone, okay, sure, you just choose psychiatry. Okay, Iftikhar, you just go into surgery. No, it's not like that. It's not like, this is what I'm saying. Try to understand yourself, your strengths, your weaknesses, your personality, your surroundings, your economic conditions. I belong to a very average middle class family. My dad was a manager in a company, although we had most of the things in life, well, alhamdulillah, that we had a small house, a car. So I was driving my dad's vehicle when I was going to the college. So it was not a bad option as compared to the other people around me, but I was not very rich man as well. But this is the sentence I always say to my son. When he weighs something, I always tell him that mera baap ek gareeb aadmi tha, so I know the qadr o qeemat of the things around me. Tumhara baap ameer aadmi hai, you drive a Mercedes, so you can do that. Yes, that's what, unfortunately, this is the truth. When we have something in our hands, we don't realize the importance of it. And when we lose it, then we realize, oh, okay, we have done something. So maybe the family medicine is not at all a bad specialty for you, but you have to sort it out. Maybe someday we'll sit and talk. You can have my number from Shoa, and I'll be happy over the weekend to talk to you about it and then guide you whatever is possible. Whatever is possible, I will definitely. Shoa is raising the hands. Go ahead.
So just a quick question. It's related to Iftikhar's question, actually. Bisma, can you turn off your audio? Because there is a lot of echo. So my question is it a good idea to choose a specialty purely on the basis of your passion and enthusiasm for that specialty and not taking into account your family or personal life circumstances? Do you think this is a good idea?
No, it's absolutely a bad idea. We do have passions for so many things. So when I was young, I wanted to get married to Ishwarya Rai. This never means that it was a good idea. I think if I would have married her, I would be a chaotic person myself. I may have broken down into pieces or maybe ended up in a mental asylum. वो पुराना लतीफ़ा सुना है ना कि फरजाना एक पागल खाने में एक शोर मचा रहा था. शख्स ने पूछा क्या हुआ, कहता है जिसको एक औरत से मोहब्बत थी, उसका नाम फरजाना था, ये इसकी मोहब्बत में पागल हो गया. दूसरे कमरे में गए, उधर भी वो एक फरजाना चीख रहा था. कहते वो क्या, कहते जी ये वो शख्स है जिसकी फरजाना से शादी हुई थी. So the both ended up in a mental asylum. So you see, the passion, I know that we have passion for few things. Like I have passion for cars, right? I love cars. I am always watching about cars. But this never means that I should try to grab the Bugatti when I don't have a money for it. Passion is, yes, it should be there because it brings life to your actually internal emotions. Yes, you should be passionate about things. You should love something. I love to talk, I love to teach, but this never means that I should cross boundaries and make sure that I won't be able to understand other people's scenario around me and I keep teaching, right? So when I am teaching, I try to be more interactive if I really want to make my viewpoint clear to the people. So having a passion is not a bad thing, but following a passion blindly is a bad thing. Having a passion is a beautiful thing. It brings life to your life, but following it emotionally is a bad thing. It should be followed cognitively, not emotionally, rationally, not emotionally. That is the point I want to make. We all are passionate about something. This never means that our passions are wrong. No, but our passions are wrong when we get emotional about it. We are not cognitive about it. जो महानूर ने बात की थी, we have to think about it, rationalize, make changes, alterations, modify, and then move forward, rather than just following your passion and getting into some kind of a hole from where you will never be able to come out. That's unfortunate.
Okay, I don't
Yeah.
know how much time we have left, but one
I
of the
was just
questions.
about to say that it's an hour 20 minutes. Do you want to continue?
No, sir, you might be getting late for getting.
No, I organize things so I can still spare some time, but I believe that if you people really felt that this was effective, we can organize another time. I don't mind that.
Sir, I think this was really effective. I can see we have 25 people from the beginning of the session and none of them have left so far. And this
Well, I don't know, but again, yes,
We can always
I still perceive that we can definitely have another session. I don't mind that. और जरूर बैठेंगे बात करेंगे दोबारा करेंगे. We can do that. Where if you people like it, Saturday suits me. If it suits you people, that won't be a bad option as well. So जाते जाते एक नज़म है, well लंबी है, तो थोड़ा सा कट डाउन करके आखिरी 3 कते सुनाता हूं. मेरे ख्वाबों की जान ले ताबीर, मेरी हर ख्वाहिशें नेहा समझे, मेरे जज्बात का ख्याल करे, मेरे तेवर को चुस्तियां समझे, मेरी गुर्बत से वो नफीर ना हो, मेरा घर गुलशने जिना समझे, वो मेरी रूह में उतर आए, तब मेरा इश्क बेकरां समझे. I always try to be very passionate about psychiatry, mental health, and of course, physicians' well-being. This physicians' well-being concept is very much in fashion these days across the globe. So the Ontario government in Canada have officially launched a physicians' well-being website. There are so many things available on these websites, how to keep yourself comfortable, how to make yourself relax, avoid the burnout phenomena. But of course, it's all theoretical. If you people feel that we should discuss and talk about your personal issues, you are more than welcome to get connected to me anytime you want to. We can talk more about the practical issues. Of course, I haven't touched all of issues. There were so many other things. I understand. अभी वो शादी वाली बात बीच में रह गई, शादी कर ली, बच्चे हो गए, क्या करना है, फ्यूचर कहाँ से बनेगा, things like that. So I think that is an important area as well, if you really want to. So each of these component can be broken down into a separate big discussion, so we can have further discussions on these topics, and then we can see. Right? Thank you very much, everyone, for
So much.
listening to me.
There are a few messages I would like to read for you.
Sorry, say it again.
Sir, there are a few messages from the audience that I would like to read for you. It won't take more than 2 minutes, if that's okay, if you allow.
Sure. Go ahead.
Yeah. So it starts with, it was amazing. Thanks so much. Looking forward to seeing you again. Definitely one more session, please, sir. And someone else says it was really good. And then Banu says, thank you so much for sir. Very effective and enlightening. We would love to have such sessions. So many other people which I'm not going to because it takes so much time. And everyone is depending on the session. So thanks on behalf of everyone, actually.
You're more than welcome, and thank you very much. And you all youngsters are most welcome to connect anytime you people want to. Take care of yourselves, be happy, stay blessed, be energetic. You people have to do a lot in life, and you will be able to do a lot in life if you remain focused. Allah Hafiz.
Thank you, sir.
Thank you, and
Thank you, everyone, for attending.
Thank you. Allah
It was
Hafiz.
an amazing session. So hopefully we'll see you guys again in some more sessions. If there are any questions, please drop them out through Britikmatic's emails or any of the social media platforms, and we'll be happy to answer them and address them in the next coming sessions. So thank you. Good afternoon, everyone.
Thank you. Thanks so much for joining us. Bye-bye. Allah Hafiz. Bye. We'll see you in next session.